My name's Victoria. I'm the coordinator at the Pelvic Partnership. We're a charity made up of lived experience volunteers. So volunteers of people who've experienced pelvic girdle pain themselves. And as a charity, we try to provide support and information to people who are experiencing pelvic girdle pain. And that might be through our website or social media. And we have a peer support group. And we're currently urgently fundraising because we have about 4 months left of money to keep doing the services, and we really want to carry on. So we're going to talk today with Emily from Meadowside Osteopathy about pelvic girdle pain, which is something that can really affect you during pregnancy, or it can carry on afterwards. So I think that what we'll do is a series of these live sessions. So today we're talking to Emily, who obviously is an osteopath, but we have people who see lots of different types of practitioners to treat their pelvic girdle pain. So physios, which you might be referred to through your hospital or visit privately. Also chiropractors. So I think we'll try and do sessions like this with a few different ones so that you can have some different perspectives. But I guess the main point is we have a list of recommended practitioners, of which Emily and I think Orit's also on the list from the same clinic. These practitioners have been recommended by at least 2 people who've been treated for pelvic girdle pain. So there's not really a bias with that. We don't choose people who are osteopaths or chiropractors. The main thing is that people have been treated and therefore they've recommended them to us. So there might be slightly different approaches, but I think that what I've seen from speaking to them is there's quite a lot of overlap in the way that they treat people and help them to manage their pain. So Emily's from Meadowside Osteopathy, but obviously we have a list of practitioners on our website who are across the UK, and a few in Ireland as well. So today we're going to talk a bit about preparing for pregnancy as well. I think is useful. That's not something that occurred to me at all before I was pregnant. Perhaps it would have been useful if it had. So bits about during and after pregnancy, how to manage pelvic girdle pain, or I'll talk a little bit about symptoms as well. And I guess, Emily, it would be quite useful if you could talk a little bit about that as well. Just because some people might be new to the area and maybe not sure if they are experiencing it or if it's something else. And someone else will join us a bit later, Natasha, who is someone who I think has been treated by you. Is that right?
Yeah, that's correct.
So just firstly, I think if you haven't heard of pelvic girdle pain and you want to know a bit more about whether that might be what you're experiencing, generally the main things that people say is that they have pain in and around their hips and pelvis at the top of the legs, doing things like walking or standing for long periods of time, getting in and out of the car, standing on one leg. Things are generally quite difficult. Bending down, climbing stairs, things like that. Turning over in bed's another big one. So I guess today we'll talk a bit about osteopathy and how you work with people. So could you introduce yourself a little bit, Emily, and maybe a bit about Meadowside as well?
Yeah, no, that's absolutely fine. So I'm, as Victoria said, I'm Emily. I work at Meadowside Osteopathy and I am part of the recommended practitioners as part of the Pelvic Partnership. So I've been working here the last 2 years now, and my main focus is mum and babies. So I treat mums pre and postpartum, and I also treat their babies as well, which is obviously lovely. And my colleague Orit, she's our practice director here. She's also a recommended practitioner. She taught me a lot, and she's an amazing osteopath as well. So she can also confront anyone with pelvic girdle pain. So as a bit of background, pelvic girdle pain is quite a broad area. It basically resembles any pain that you're experiencing around your pelvis. But it can also be into your lower back, into your hips, down your legs, down your thighs. So it can be quite broad. So Victoria already covered some of the common symptoms that people come in with, basically saying, I think I've got pelvic girdle pain, I have difficulty doing this and this. And those tend to be the single leg activity, so walking up and down stairs as well, just walking in general, in and out of the car where you're basically opening one leg at a time. So there's that rotation through the pelvis. And that's where a lot of the pain comes from. So there's 2 joints, well, technically 3 joints, but you've got 2 at the back of your pelvis, where your spine basically attaches to your pelvis at the back, and then you've got your pubic symphysis at the front. Now they're only really very subtle movements, but during pregnancy those movements can come a little bit imbalanced, or there might be something that causes pain in that area. So that could be hormones, that could be the way that you're loading differently, it could be muscle changes or muscle imbalances, or also previous injuries, either in your hips, in your back, wherever it might be. That can also predispose you to pelvic girdle pain. So the two joints that I was talking about, they're also supported by lots of ligaments basically around your pelvis. So it's all a natural process, but in that process you can have these subtle imbalances, which then mean simple things like walking do become really difficult. So that's kind of where we can help. So from the osteopathic side of things, we're quite holistic. There might be a few different things that we take into account. So whether you've got another little one at home, which might mean that you're picking up a toddler regularly, as well as trying to do the washing and everything else, or if you're working and sat at a desk for long periods of time, how that's going to influence your muscles around your pelvis, around your back, all that kind of thing. Also how you're moving as well, any previous injuries, which I think I said already. So we look into everything from quite a broad perspective. So obviously we're focused around the pelvis, but we will look at probably your back almost from top to bottom to basically make sure that your back is functioning as well. Because if your back is moving as well as it can do, then that will take the pressure off those joints that I was talking about in your pelvis. So if your lower back's moving as it should do, as the middle of your back is moving as it should do, your thoracic spine, and the same with your neck, if that's all moving as it should do, then it just helps to take the pressure off those joints in your pelvis and can just make general day-to-day movements a lot more comfortable. So that's what we tend to work around. Our style of treatment tends to be fairly gentle from my approach. I know everybody has their own approach, but especially with women during pregnancy, because there's so many changes going on, both from a hormonal perspective as well as everything else, I tend to treat quite subtly, which has always been quite effective from my experience. And Natasha will be here later to be able to talk through that as well. So it tends to be gentle massage and gentle articulation around those joints that I was talking about, and also depending if there was restrictions elsewhere. So when I say articulation, that basically means that when you're lying down, when all those muscles are relaxed around those joints, it means that we can move gently with those joints as the muscles are relaxed. Previously, obviously, when you're standing, all those muscles are tightened to try and support your posture, but when you're lying down, those muscles become relaxed. So it's a bit easier to get movements through those joints. But it's really subtle movements. It's almost like a deeper stretch, again, just to create a bit more space around the area. So that's a bit of a general approach as to what we'd look at. If anybody has any other questions about things specifically or any symptoms, feel free to message us on our Instagram. But that's a quick summary of what we do.
So we mentioned a bit before about things that you might be able to do if you're thinking about getting pregnant, or maybe if you're thinking about getting pregnant again after you've maybe experienced PGP. I know this is something that I didn't ever think about, because before I was pregnant, I was quite fit. I was really fit compared to how I had been the rest of my life. But it was all things like running and cycling and swimming and all stuff like that. And I wasn't weak. I definitely had in my mind strong legs and things like that. But I think for me, there was probably other things I could have done that would have made me a bit stronger in other ways. And I don't know if there's any of those that you'd like to talk about.
Absolutely. I think quite often, again, when we're talking about any movement and any exercise is good movement, but there's certain things that you do need to be aware of when preparing for a pregnancy. If you can, if you are planning, at least, there's certain things that you can do to prepare for it. So whether you're in the gym or cycling or doing whatever you're doing, we tend to focus on the big muscle groups. So, for example, your glutes, which are your big muscles, which are basically your bum cheeks. Basically, they're your glute muscles. Also your core muscles and your pelvic floor, as well as your thigh muscles, which all attach around the pelvis as well. These are all things that are great to strengthen, but actually it's those more intrinsic muscles, which are the smaller muscles, which are almost below the big muscles, which are really also important to strengthen. So because those ligaments become a little bit more flexible during pregnancy, because your pelvis is obviously changing in preparation for pregnancy, those muscles then respond to that by trying to tighten up to almost try to stabilize the area. And when they become tight, that's what can create imbalances. So again, if we tend to lean subtly onto one side, those smaller muscles will tighten up. which can eventually cause a rotation, because those muscles, they're slowly tightening, and if they're tightening more on one side than the other, they obviously attach to those joints that we were talking about, so the pubic symphysis and your sacroiliac joints. They all attach around the same area. So again, you can get subtle rotations if those muscles are tightening more on one side than the other. So the first thing I would approach is a pelvic assessment, basically, to see if there are any of those imbalances already, because they can be really subtle imbalances, which actually, if you loosen or relieve in some ways, that will reduce your chances of pelvic girdle pain. And it will also give us an idea of where we need to strengthen as well to prevent it. So in terms of general preventative measures that you could make, I think a pelvic assessment is the first good port of call, just again to have a general understanding of what your pelvis is doing, where we might need some strengthening and where we might need to loosen it. As I say, that doesn't have to be with us, that can be physios, chiros, anyone that's kind of experienced within the pelvic side of things would be good to do. But even more general than that, even things like Pilates, that's really focused on balance and core strength. So even something like as simple as that can be really good at just engaging those muscles that need to be really engaged to support you as much as possible through the pregnancy.
I think it's difficult because hindsight is obviously very useful, and I know lots of stuff now that I didn't know before and I never would have thought about, where I think I probably did have some imbalances previously that had been so subtle or didn't really affect me. It was only doing certain things that I didn't ever think about it. And that probably is something that contributed to what I experienced later on. And I think I probably have hypermobility that I never thought about being a problem before, or just for me that was normal. That probably also contributed to it. But what would you say then, obviously once you're already in it and you're already experiencing that, and it gets to the point, well, for me it was certainly the point where I was given exercises by my NHS physio, and they just gave me this sheet of exercises and I physically couldn't do them. I was told by my private physio not to do anything that caused pain, and all of those at that point did. So it was too late to do those things. So what do you think is the best course of action in that scenario then, once you're already in it?
So once you're already experiencing pain, I think hands-on treatment can be really beneficial, because even if that gives you temporary relief, you can at least then start with those exercises. So again, we wouldn't push you to do any exercises that you weren't comfortable doing, and we don't encourage you to push through pain or anything like that. But even if it was to give you a day of relief and you were able to then do those exercises, and even if you then had to do less on a day where you were a little bit achy, as I said, we wouldn't push through if you were already in a lot of pain. But if there were subtle aches and pains where actually we thought it was safe to do exercises, then we could encourage you to do that. So I think if you're already in pain, it's worth having that assessment, but also having hands-on treatment as well, because temporary relief can also just be so positive from a mindset point of view as well, just to be like, oh my God, this doesn't have to actually be there forever. There can be something that will support me through it. So I think that's one thing. So hands-on treatment. Again, a pelvic assessment. So if you are just given a sheet of exercises and you're still not quite sure where the pain's coming from, or if you think there is a rotation through your pelvis, then I would encourage you to get an assessment, wherever that may be. And again, just to detect those subtleties. Just because you're already in pain doesn't mean that we can't help you. I think that's the important thing. There can be really subtle things that we do that just make it a little bit more bearable, and then give you exercises. Again, we'll always do the exercises with you in the room to make sure you are comfortable doing them as well. And again, just to maintain what we've already begun working on. I think it's definitely not a one size fits all. And as I said, there's some real subtleties sometimes that can actually cause indirectly quite a bit of pain. So if we can relieve them slowly over time and get you to a stage where things are a bit more comfortable, that's when we can then introduce the exercises.
So you mentioned a pelvic assessment a couple of times, just for the benefit of people who might not know what that looks like or what to expect. Could you explain a little bit about it?
Yeah, of course. So that does vary from practitioner to practitioner. So just to put that out there. But from my perspective, I only treat externally, and I will only assess externally. So there's some people that will do an internal pelvic floor assessment. Just to make it clear, I don't do that. But there are other people that will do that. So from an external perspective, so as I said from the beginning, so we'll take that broader step back and that broader look at everything. So we'll probably ask mum to dress down. So usually that's just into her bra. and maybe if they were wearing leggings or something like that, just to roll the top over so we can get a good look at the pelvis. And the reason we ask you to take a t-shirt off or get dressed down into your bra, or it can be a strappy top, is just to get the general appearance of how the spine is looking for those imbalances and that kind of thing. So from an external perspective, we'd look at you first. Again, as I said, usually in a vest top or a bra or shorts or rolled down leggings, something like that. Have a look at those things for imbalances. So we'd look at the level of the pelvis. So we then might put hands on at that point. So we just have a look first to see if there was anything obvious. And then we put our hands on the pelvis. So that tends to be, actually, if I show you a pelvis that I've got here, I'm hoping you can see that. So the things that we'd look at is the level of your pelvis here. So there might be subtleties where there's one side higher than the other. And I'm obviously making that a bit more obvious than it tends to be on an actual human. But it tends to be things like that that we look for, and we'll have a feel around these joint lines here as well, again, to see if there's any obvious rotations. So for example, if I show you from the side, this is one side of your pelvis, so this is the side angle, and this is where your hip joint sits. And there can be subtleties where this pelvis is basically rotated or tilted in that position, so like that. So if we were assessing from the back, we then might feel this bone, for example, more prominently from the back because of that. And this is, again, your pelvis at the front. So this is your pubic symphysis, which tends to be an irritated area. So again, as you're standing, it depends obviously whether you have a bump yet, but either way, the kind of principles are still the same. And we'll always make sure that you're comfortable with us feeling around that area. But we tend to work almost around the top of the pelvis, work then round the front. So just kind of feeling basically before we then get to the front here, again, just to see if there's any subtle rotations. To begin with, we'll do that standing, and it will just be gentle feeling. And then eventually we'll get you lying down as well. And then we'll do the same thing. The reason we do that lying down as well is because that's when those muscles are nice and relaxed. So then we can see if it's the muscles actually pulling the bone into that rotation, or whether that's your normal. So that's a quick summary of what we'd look at. But as I said, we'd also look at the rest of the spine as well. Sorry, this is a bit of a wonky spine, but we'd also have a look everywhere else as well to make sure that it was loading correctly. Because again, if these are all moving properly, it takes the pressure off these two joints here, which is your sacroiliac joints.
Well, you've got your pelvis around and talking about muscles.
Yeah, that's fine.
Someone's asked a question that you might be able to explain, which is about sciatica pain.
Yeah.
So having sciatica pain along with PGP, and that's remained 6 months postpartum. So they'd like to know why that is, and if there's a relationship between the PGP and the sciatic nerve.
Absolutely. So there absolutely is. So the yellow parts are basically your nerves, and your sciatic nerve passes through your pelvis. So this is almost like underneath your glute muscles in this area. It passes through here and then comes down the back of your leg. So again, if there's a subtle rotation through your pelvis, which we quite often see both during pregnancy and postpartum as well, that just puts increased pressure on that sciatic nerve. And it can even be something as simple like the muscular involvement. So again, if your pelvis is rotated in this position, these muscles are likely to be tighter, and then that can then put extra pressure basically on that sciatic nerve. So there is a relation in the pelvic girdle pain, but again, it depends what you're presenting with. But if there's those subtle rotations which causes that extra pressure on one side of the pelvis, then it's more likely to put pressure on the sciatic nerve on that side as well. So that's why we tend to see them hand in hand. And other nerves can be affected as well. So I would certainly encourage a pelvic assessment to see what's going on there, or to see if there is anything subtle that's going on. As I said, it's not usually a permanent thing when it's related to pregnancy and postpartum. I think often the fear is, oh, it's going to be there forever. But honestly, that's not the case. It can just be that the pelvis has stayed in the same position and it just needs some subtle readjustments or loosening to take the pressure off that sciatic nerve.
I think the thing to do about it is to get someone to properly look at it and do, like you've described, an assessment and looking at the muscles and muscle release, things like that. I know from my own personal experience, which obviously is not applicable to everyone, because you would need to get an assessment and see exactly what the cause of yours is. But mine, I can feel now, like this has been years for me, and I can feel now if something shifts, I know that my leg doesn't function very well. And then I can immediately feel like all the muscles, basically from all the way up my leg, all the way up the back, basically as far as my neck, become really tight. And that includes the muscles, like you said, in your bum cheek there. then I feel like that gets so tight, and then I start to get things like that nerve pain or things like that. But
Yeah.
obviously then there might be other causes for you, so you should get that looked at for yourself.
And often when you've had discomfort for a long time, our natural human response is the fight or flight response. And again, if we're trying to protect something, or protect an injured area, that's basically so that we're best prepared for when we need to run away from a scary animal. That's what we're built to do. So if there's an area that's injured, our body's response is to protect that at all costs. So in those subtle imbalances, you might not even experience the pain yet, but those subtle imbalances, our body is adapting all the time. So it might even be before you're actually experiencing the pain that your body's already adapting for it. And in your case, Victoria, obviously I don't know without giving you a proper assessment, where you've obviously had the pelvic girdle pain in the past, and whether you subtly compensate or lean over to almost protect that side, and whether that's what creates tension elsewhere. It could be. But this is where I think pelvic assessments can be really useful, and also just to give you that kind of mindfulness of it as well, to actually be like, oh, actually I see what you mean. And when somebody puts your hand on your pelvis, we say, oh, actually, can you feel that this side is higher than the other? And they go, oh yeah, I can actually feel that. Even then giving you that mindfulness can be really useful at then adapting yourself, so that if all those muscles are tightening up, actually I don't want to get them too tight, because that's when I'll experience pain. You can do something about it before you actually get to the painful point, basically.
It's true, and that did actually help. Understanding it more has helped me quite a lot, because it's not, I think when you don't know what's going on and nobody's explained it to you, and people haven't assessed you properly or looked at it and explained how things are moving or how things work, and then therefore how the muscles work alongside it, with no understanding of any of that, it's scary to be in that pain for a long time and not understand that there's something that can be done about it. So I think that's the thing that's difficult for people.
Absolutely. And I see, as I said at the beginning, I see babies as well. And often we say to mums, how was pregnancy? And they often, it's a quick answer, oh, it was straightforward, no complications. And then you eventually find out that they were in pain for 6 months of their pregnancy, and they were just told, oh, some people do get pelvic girdle pain and you just put up with it, or there's crutches if you need it. And I understand we'll do our best to help everyone, and there's usually something that we can provide, but that is still not fully understood yet. There's still so many women that just go through it just because they think it's part of pregnancy and because they think it's normal, but actually you don't actually need to put up with it. There can be so many things that so many different people can do for you. So I'd really urge anyone, even if you're not actually experiencing pain, just to be like, no, I want to know that I'm in good shape, and I want to know that my pelvis is doing what I'm doing, my body's working for me. I would encourage anybody to do that.
For sure. I think if you are that person who's got pain, you don't quite know why, and then you've mentioned it at your appointments or whatever, and they've said, don't worry about it, it's fine, it'll get better and things like that, I would encourage you to push to get actually looked at and make sure that someone looks at you and lays their hands on you to assess what you've just described, because then hopefully they will see that there's something that needs treating.
Absolutely.
So I guess there's a couple of other things that are the types of things that people might ask, which maybe we'll go through now, but then leave a bit of time to talk to Natasha as well. Maybe there's 2 points that I can ask you about. One of them that I think people frequently worry about is, what about when you actually have the baby? And they're nervous that they might have to have a cesarean birth because of having this pain and things like that. Could you suggest anything in that area?
So when they've previously had another...
If you've got pelvic girdle pain and you're going to then have to deliver the baby, what would you recommend for the delivery? Lots of people contact us and say, oh, well, I will not be able to have a vaginal birth because I've got this severe pain and things like that.
So again, it can depend on your history in terms of whether you've had a cesarean section beforehand, or whether it's your first time pregnancy, second time pregnancy, sixth time pregnancy, whatever it may be. It does depend on those things. But I think from things that you can do, again, it would be going back to assessing and making sure everything's where it should be. So if there is anything obvious that's out of place, we can then help with that to ease the tensions from birth. I think also your pelvis can change right at the last minute as well during the birth process. So I think just because you're experiencing pelvic girdle pain doesn't necessarily mean that you're going to have the worst labour or you won't be able to have a vaginal birth. If that's something that you want, it's certainly something that can happen. Again, it's just making sure that you and baby are safe during the whole process. So if there's things that work for you throughout your pregnancy to relieve the pelvic girdle pain. For some people, that might be kind of subtle muscle activation, again, just to feel that those muscles pulling everything in the correct places. That can be great. Or taking comforts that you have at home as well. So if there's a particularly good pillow that you have at home, that as soon as it's between your knees, that you feel comfortable with that, then take that in. It can be so many different things, but it's really subjective. And again, also making sure that you have the strength there as well. I think that's another thing, one, to be able to push, but also I think another big focus is the pelvic floor group, which is obviously a massive thing and it does need to be spoken about and educated about. I think there's a tendency to then over strengthen or over tighten because people are worried about incontinence and things like that later on, but actually by doing too much of it, your pelvic floor can also become too tight, which can make things actually trickier if you're not doing them in the correct way. So again, this is where I'd really encourage proper assessment to make sure that you're doing the right thing or do everything that you can that's actually right for you and not just general advice, because one thing might fit for one person but actually be completely different for somebody else. So I think to quickly sum up, because I went off on a bit of a rant there, if you're preparing for a vaginal birth or C-section, whatever it is that you might be preparing for, and you're concerned about pelvic girdle pain and whether you'd be able to go through the birth process, speak to someone. I think even kind of seeking advice from midwives to basically have reassurance that some people with pelvic girdle pain, they don't suffer during the birth process. Also taking comforts from home. So whether that's hot water bottles, pillows, anything that you've used in the past which has helped with your pelvic girdle pain, take those with you. Lots of different things, really.
I think the bottom line is that unless there's other reasons that would mean that you couldn't have a vaginal birth, pelvic girdle pain wouldn't be the only reason. And
Exactly.
there's lots of things you can do to make yourself more comfortable during birth as well.
Yeah.
Like a water birth or things like that, if you can be helped into the pool. There's no reason to be afraid of that. And lots of people say that when they go into labour, actually that pain reduces. Experience so much pain, labour's a bit less scary as well.
Oh, no, exactly that. No, there's lots of people that exactly say that they can even be in pain, obviously, while they're contracting, which is kind of the usual type of pain. But then as their pelvis begins to shift and as baby actually begins to move into the birth canal, that pain then reduces from the pelvic girdle pain side of things. So certainly that, and of course water births and all that kind of thing. There's also like hypnobirthing courses that some people do, which just educates you on pain management as well. So I would encourage people to do that as well if that's something that they're worried about, because I think even settling those anxieties about the whole birth process can be really helpful, and just help to be mindful during that kind of scary time, I guess.
I think it's the same as everything, the same with PGP and with birth. It's like having a good understanding of the process of everything and how everything works that actually is quite helpful. So what would you say about supporting people after birth who've had PGP or even just in general?
Often we kind of say, so especially if there's C-section, we often say try to give it 4 weeks before you come and see us, just to allow for things to kind of settle down a little bit, because obviously there's lots of changes and you also need time to heal. I think that's an important thing. For lots of people, because they're still healing, that pain won't go away first of all, but that doesn't mean to say that it won't. Sometimes your body needs time to heal and adjust, and as I said, you know, there can be quite quick changes that happen around your pelvis even at the final stage of birth or final stage of labour. So I think that's an important thing to bear in mind. In terms of how we would support you, it'd be a similar kind of assessment. We'd have a feel around your muscles around the pelvis to see if there's any that are particularly tighter than others. We'd also have a look for those subtleties to see if there was any rotations that were either still there from pregnancy and whether they've maintained after birth, or whether there's been any changes again from the birth process. Equally looking at your pelvic floor muscles, so going through kind of some general strengthening. As I said, I don't do internal exams, but I know there are some people that are either pelvic floor trained or they've got other trademarks. So a trademark, for example, to look out for is mummy MOT, and they do more in-depth assessment if you wanted to kind of go down that road of looking more into the pelvic floor. There's things that we can still do, but it's obviously from an external perspective. Getting mums back moving alongside, you know, after a little one. So there's lots to kind of change and adapt to. But again, from an osteopathic point of view, there's things that we can do, both with hands-on treatment and also to make it as easy to do while you've got a newborn baby as well.
Final thing I think I'll ask you was about, mentioned supporting families and babies as well.
Yeah.
I don't know very much about that at all.
Okay.
I've never seen an osteopath.
That's fine. So yeah, I can talk all about that. That's fine. So mums will come to us for lots of different reasons. They'll bring their babies in. The most common one is reflux, colic, feeding difficulties. So feeding difficulties can mean kind of, latching onto breast or latching onto bottle, or worry about weight gain, all that kind of thing. There's more kind of subtle ways that might kind of suggest that babies are struggling with feeding. So the way that we look at babies from quite a broad perspective, even with colic and reflux, a big part of our focus is actually around kind of the mouth and around the jaw, partly because that's the first stage of digestion. That all happens kind of around the mouth. So if there is tension there, which means that baby isn't able to latch onto breast properly or onto the bottle because they can't open enough through their jaw, it can be really subtle ways of relieving tension around their jaw that just means that they feed more efficiently. And if there was tension in their jaw, it could be that they then use their tongue more because they can't open their mouth wide enough. So they then suck harder, which means they then take in more air, which then can present as either colic or reflux. With reflux, it's more of a developmental thing because there's a valve that sits on the top of your esophagus, basically, which it works like a non-return valve so that, when they're lying on their back, the milk doesn't flow back up as it's pushing on that valve. But sometimes there's a weakness there. And, babies at full term can still have that weakness there. And sometimes if there's excess wind caused by more air intake, that can just push on that valve more and almost create a weakness. So that's why we look at the jaw first. But in the context of colic and reflux, we also look around the diaphragm. So depending on the birth process, if it's a particularly quick birth, for example, babies don't get that prolonged stretch through the birth canal. So they tend to still kind of maintain that utero scrunched up position, which can just mean that they're still quite tense through their diaphragm. And again, if there's some tension through the diaphragm, which is causing some imbalances, it can affect the rate of digestion, how they're able to burp. That might present with more hiccups, all that kind of thing, just because there's some subtle imbalances there. We can kind of broadly assess for, feeding issues. We also work with a lactation consultant called Polly, so she works with us. So if we're suspecting tongue tie or something else like that, or any other feeding issues really, we refer to Polly as well. Also flat spots on the head, so like geocephaly or brachycephaly, so the flat spot at the back and the flat spot at the side. That can be kind of like either from birth strains or the position of baby in the pelvis, or it can be linked with their neck. So if they've got a torticollis, which basically means that their muscles are tighter on one side and they struggle to then rotate both ways, they can just want to lie on one side of their head, and just where their skull is still quite soft, that can present as like flat spot basically, which is what we can help to relieve, both by working on the neck and around the head as well. So yeah, I think that's a quick sum up.
There's been a couple of questions. I'm going to ask you one of those while I try to invite Natasha at the same time. Just while Natasha is buffering, do you have more chance of getting PGP in a second pregnancy? And I think that generally is, if you've had PGP and then you're getting pregnant again, you are more likely to have it in the second pregnancy. But that doesn't mean that you definitely will. And generally, because people who've already had it previously and they've had some treatment or started to understand it and recovered in between, they tend to have much better outcomes the second time around because of just having that understanding and awareness. And as soon as you feel that you have symptoms, there's adjustments that you can make, or you can make sure that you get a referral really straight away. If you know that you've had PGP previously and you find out that you're pregnant, I would just say go and ask for a referral straight away, even before you get symptoms, because then you'll be on the list already. And you should be willing to do that in the NHS. Obviously, if you're in a position to pay for treatment, you can make those appointments with whoever you were seeing before as well. But yeah, I don't know if you have a comment on that.
Yeah, I think obviously there are some things that mean that in your second pregnancy that you're more likely to have pelvic girdle pain. Another reason for that is because of the hormones as well, and how that kind of has an effect on the ligaments around your pelvis, especially if it's quite a short period of time between the pregnancies. Then those ligaments kind of don't kind of build up their full strength again before you then fall pregnant, and the relaxin then does the same thing again. So they're already a little bit stretchy before relaxins come in full force. So it just means that you then need more muscular support. So again, it doesn't mean that it's non-resolvable. It just means that, you know, we need to do more kind of intrinsic strengthening, probably in advance as well. You know, even if there's subtle things that you can do from home, like as soon as you find out you're pregnant, even before you're kind of experiencing discomfort, then I think that's well worth doing. Or again, going for a pelvic assessment somewhere would also be really useful. Just to give some context, Natasha I saw during pregnancy, and also when she had her little one. I then saw her little one as well, and I think I saw Natasha for a postpartum checkup as well, or it might have just been that we kind of had a quick conversation while I was treating her little one.
Something that we talked a little bit about, but maybe not loads, was just kind of, even if you are getting treatment, are there other things that you can be doing at home alongside it that would be helpful, or avoiding doing?
Yes, so there's things that you can kind of like look into, so subtle things like how you're meant to be turning in bed, how you should be kind of getting out of a car, because it's those subtle rotations, which is where your pelvis is moving. We want to try and limit those as much as possible. So trying to keep your knees together basically and moving everything together is a big thing. So obviously from the osteopathic holistic side, we'll kind of like look into all those things, but you know, general health stuff, moving, exercising if it's comfortable to do so, eating well, drinking plenty, are all a good start. And in terms of movements, trying to reduce that pelvic rotation as much as possible. Probably like reducing your load in terms of exercise, so low impact tends to be really effective.
Yeah, there's quite a few practical tips on our website. If you go to the section that says living with PGP, and there's advice on kind of day-to-day tips and managing pain, and also advice for if you're having treatment and you're not sure that it's working, things that you can do alongside it, or advice for if you've asked for treatment on the NHS and you feel like you're getting anywhere. There's some tips. We have a toolkit for talking to your healthcare practitioners, so explaining, I have this pain, this is how it's affecting me, this is what I would like to be done about it, and that kind of thing. And I guess from this, which is quite useful, is understanding what that assessment of the pelvis looks like, and that really pushing to get that done would be useful. But now we've got Natasha. So could you share then a bit about your story, about your journey? When did you start noticing pain? How did it affect you? And how did you come to decide on seeing an osteopath? I don't know if you were already doing that.
Yes, for sure. It was about week 20 of pregnancy. I felt really sick basically up until week 15. And then I had this beautiful 5-week period where it was like, oh, this is what everyone talks about, to be pregnant. I'm having a lovely time. And then suddenly at week 20, I was noticing just being in so much pain, particularly at the end of a day when I put my feet up. I just wanted to just sit on the sofa. Pregnancy tired is the next level thing. And it was then trying to move after having had my feet up. I was like, oh my goodness, this is like stabby pain. This can't be normal. And it was also playing the piano, like pressing the pedal and stuff. I was like, wow, this is very sore. And I'd got myself into pretty good physical shape, I thought, before pregnancy. I was doing half marathons and Tough Mudders and stuff. I was like, yeah, I've given myself the best chance here. And I just texted my friend, basically, who's a midwife. I really recommend having a friend who's a midwife. It's very useful. I explained what was going on, and she just said, oh, Tasha, I'm so sorry. This is classic presentation of pelvic girdle pain. And I was like, what's that? Never heard about it before. She sent me to the Pelvic Partnership website, and there was a whole process of like, oh, this is going to be tough. Obviously, you know, pregnancy is going to be hard, but I was like, okay, this might be really hard now. And like grieving the pregnancy that I thought I was maybe going to have, if that makes sense. Like, I think obviously you hear about people having tough pregnancies, but I don't know, I was a bit like, oh, but I'll be fine. Like, I'm going to be okay. And then it was like, oh no, actually this is going to be really difficult, and I might be in like near constant pain for more than 20 weeks, which was like, so just psychologically preparing for that was a thing, as well as then experiencing that pain. So yes, my friend said, oh yeah, go through the NHS stuff and tell your practitioners and that kind of thing. But you may also want to go and see someone privately, because it might happen faster and be more effective. So yeah, it was really useful to have this list on the Pelvic Partnership website of people that I could contact. And I'll be really honest, the reason that I chose Meadowside was because they were the closest to me physically. Because yeah, driving was really difficult, like clutch control, that sort of stuff. I was like, right, I want to be in the car for the least possible amount of time. And I was so lucky that it ended up being Meadowside. It's worked out really well. I did go through the NHS processes. They saw me twice, and the second assessment, they were like, Yeah, here are crutches basically, and they did help, but I didn't want them. I was really unhappy. Yeah, so that was the treatment that the NHS were able to offer me. So I was really pleased to be able to come and see Emily and have a bit more involvement than just here are crutches, and hopefully you'll be all right on the other side.
Yeah, obviously nobody wants there to be a situation where it's like gatekeeping treatment from people because you have to pay for it. But I don't know, because I did give up and I paid for some physio, I then stopped pushing. So the message I would give is to, if you are in the position where you're trying to see someone on the NHS and you are in a waiting list, or they've seen you and they haven't, they've given you some exercises but they haven't actually looked at you, or they've done that and said, have some crutches, there's nothing more that we can do, keep trying. At the very least, keep trying. If you're not able to pay for treatment somewhere else, then do keep trying and make it clear, how it's affecting you. So did you start seeing Emily at that point? Was it around 20 weeks when you started?
Yeah, maybe a couple of weeks later, week 22, something like that. Yes, yeah.
It sounds like your midwife friend is a very good midwife.
Yeah.
Lots of people kind of say that they get stuck at that point as well, that their midwives aren't that familiar with it, and so they kind of say, that's fine, just it's normal. Therefore, they don't necessarily push for the referral.
And I think actually in some ways having the crutches was actually a helpful marker for that sort of thing, that like when you're in labour, turning up on my crutches, everyone goes, oh, okay, like suddenly now we're going to kind of treat some of this differently. So it was actually quite useful as that kind of marker. Like I got given a wheelchair quite early and that sort of thing. So there were benefits to the crutches, but it wasn't what I wanted.
Yeah, I think there's a thing of, like, it doesn't necessarily mean that you won't get better or treatment won't work for you. So you can carry on, trying to do the treatment. So you mentioned something else that I think is important there that we haven't really discussed, which is the psychological aspects of it, which obviously are huge. And that kind of feeling, I guess, for me, what was definitely a big improvement was speaking to someone who understood the thing. And at that point, it was when I saw a physio. But for you, probably seeing the midwife or speaking to your friend who's a midwife was probably really helpful. I think someone that's just kind of, I know what that is and this is what you can do about it.
Yes, that you're not just a bit broken. Like actually there are some treatment options available, and obviously the physical stuff that Emily is able to do was incredibly helpful. Like even just to have one night where I wasn't in pain a week it made all the difference. But actually, obviously a lot of the chat with midwives and that sort of stuff, like all, how are you taking the best care of the baby, which is obviously like so important. But coming to see Emily, to see an osteo, was like, oh, actually you matter too. Like it matters that you're in pain, and we're going to try and deal with that actually. And that was meaningful to feel like seen. Yeah. Really, that wasn't a small thing to come and feel like there was something that I was there too.
Yeah, definitely. I think that's how a lot of people feel like that. There's so much when you're pregnant. You kind of feel like, people are looking after you because of the baby that's inside you. And then you have the baby and then it's like, okay, now I'm going to look after the baby, and whatever's happened to you feel a bit like cast aside. So what was your experience like then after you had your little one in terms of
I was just getting a bit squeaky. I think I was quite lucky in that within a week it basically went away. So that first week was really difficult. Obviously labouring was really difficult. There were like very few positions that I could be in comfortably, and that first week was really hard, especially trying to find like comfortable feeding positions, because I was pretty keen to breastfeed, and again having my feet up was very sore still for my hips, but I didn't want to have my feet down because there was like a lot of ankle swelling and that sort of stuff. Trying to find comfy positions to breastfeed in was really difficult that first week, but I was lucky, I think, in that within maybe 6 or 7 days it went away. Like I had to go take you to the hospital for your sort of like first week checkup, and I gave the crutches back in that visit, and that felt very that felt momentous. But like, only these can go in the crutch bin. I think maybe it's one of those things that just feel a bit like luck. Do you know what I mean? Like, I feel like it's hard to know what to do if it is going to happen to you. It's hard to know what to do if it's going to happen if you have a younger brother or sister one day. But yeah, I think I was lucky. Within about a week it went away. So yeah.
Oh, that's great. Someone has asked as well whether the pain eases after the birth of the baby or if it takes a long time in exercises, and I would say that that's really variable. I think the majority of people, is probably an experience like you, that it resolves after a short period of time. For some people, like mine, lasted a lot longer. But I think there's so many factors that can contribute to it that you couldn't really say, like, to an individual from looking at them, you're going to have this for a long time, or it's likely to take you a lot longer. I think probably for me it was quite severe, and my birth experience wasn't very good for whatever reasons, but that probably contributed to it prolonging of pain. And I think that I probably have hypermobility, which makes that more difficult as well. So I think try not to feel, when you're in the scenario, like not knowing how long you have to deal with pain for is a really hard position to be in. So even if it does carry on, I would say it will reduce a lot. It does get a lot better. Even if it lingers a bit, it's not like the pain that you're experiencing when it's kind of at its worst. So it will get better, and it will get better with, you know, time and treatment and things like that.
I just remember having to take it one day at a time. If I thought too much, even just about, oh, I'm going to be in this level of pain until I give birth, that was just too overwhelming. I just really had to sort of find the strength for one day at a time, one night at a time. I know it's very easy for me to say now, probably, but when I was in it, that was the only way that I could cope with it. If I was thinking too much about the fact that it was like chronic, I would just get overwhelmed and miserable. So I had to try and break it down into smaller chunks.
Yeah, good. The same person has said, okay, it sounds like they do like baby classes. Oh, I appreciate this question. Could I make changes in my classes to help mums be more comfortable, as we usually sit on the floor? And that's something that loads of us have mentioned in the charity of people that have experienced it for a long time. Like you said, something that also is really hard psychologically is the experience of pregnancy, where, you know, you might really look forward to it. And even if there's things that you don't enjoy, like sickness and things like that, it feels like a bit of a loss. Lots of people feel a bit robbed of that experience, that they can't enjoy any of it, and that kind of
moving process
where people are like, oh, look at that lovely pregnant lady and blah blah, and you just feel like a bit sad.
Are they glowing? And I was there like, oh, just in so much pain.
You know, hobbling around on crutches, and you know, I did get a train seat all the time, which was nice. But this is another point afterwards, if it does carry on, where you are going and doing mum and baby things, and then it's hard to join in. And for me, that was quite hard as well. And even when they got a little bit bigger and kids were playing and running around and kicking footballs, and I couldn't really join in, and I felt a bit like people didn't really realise why, and I just looked a bit like a Scrooge that didn't want to play. But this baby class thing, I guess what I would suggest is to have some chairs if possible for the things. I used to sit on a chair for some of those if I could, because it was just like getting down onto the floor once I could manage and stay on the floor and play and do like songs and things. But there was a baby signing class, and there was a lot of getting up and then getting down and then picking the baby up from the floor and getting down, and for me that was too much.
You do songs where you have to like lift them, and it's just like, oh my goodness.
Once at the beginning and once at the end, but not over and over again, that kind of thing. But yeah, having options available where you could sit in a chair would be useful, I think.
And I guess even just having those, like, oh, these are chairs that you can sit on if you need to feed your baby through the class. It doesn't need to be like, it could be like for a variety of things rather than like, because you have PGP specifically, it's like, oh, chairs are available.
Yeah. Another thing I had when I was pregnant, I actually found that there was very few chairs that I owned that I could comfortably sit on at all. So we had to get rid of our sofa and get a different one because it was really low. Anything that was a little bit low was not a good place to be in. And you mentioned
when we were going away and staying in beds that were low and be like, how am I going to get into and out of this?
Or a car that's got a low seat. Yeah, I would recommend investing in some taller chairs, because I used to just sit on like a tower of things to make sure basically that your knees are not higher than your hips. I mentioned feeding, like breastfeeding. Sitting up in bed is a really bad position for your pelvis to be in. I'm sure that Emily will agree. If you are breastfeeding, then lying down is probably the best thing to do, that I would say. The sitting, the hunched sitting is also a bad one, which I did a lot of, and it's not good.
Some people also get coccyx pain as well, and you can get donut pillows, so it's a pillow with a hole in the middle, so that it really takes the pressure off your pelvis if you are sitting down. Yes, while still comfortably, and you can use that, you know, driving and all sorts of different positions. So yeah, people get lots of different types of pelvic girdle pain, but there's often things that you can do that kind of make those situations like breastfeeding a little bit.
Yeah, listen to those types of symptoms as well. If there's specific areas of pain that you've got, like you said, coccyx pain and things like that, or like pain with other things that might indicate issues with pelvic floor or something like that. If you're still experiencing pain for quite a long time, despite having treatment and alleviating some of those things externally, then I would recommend having like an internal assessment as well, because there's quite often pelvic floor dysfunction associated with PGP, which may be contributing to the cause of it, but may also be from, you know, compensation of the muscles from your pelvis not quite functioning correctly for a long time.
Yeah, absolutely. Natasha, would you mind just giving a brief word of how you found treatment? Were there times you found it uncomfortable? Just to give listeners a general idea of what they can expect during their treatment. I've obviously given my share on it, but from a patient perspective, I think it's really useful as well, if you wouldn't mind.
Yeah, it was really helpful just to come in the first time in basically leggings and a strappy top and have a proper look at, because it's the sort of thing you just go through your life. You know, say Victoria, like, I probably am a bit hypermobile. We just don't know this stuff about how our skeletons work, because no one ever tells you, no one ever looks at you. So it's really helpful to sort of like be checked over. And then pretty much the whole session, I would be either on my back or on my side. Emily was so careful about supporting bump and making sure that I wasn't in pain. And you know, you can take as long as you need to kind of turn over into those positions and that kind of stuff, because that was all really hard. And then basically to sort of manipulate my legs. That sounds really vicious. It wasn't at all. It was so gentle, but just sort of positions that there was no way, especially by that point, I could have got myself into in terms of kind of just relieving pressure, relieving tension. There'd be some sort of like deep tissue massage, that sort of thing. I'm pretty sure I kicked you several times just from involuntary muscle responses. But again, just stuff that there was absolutely no way that I was going to be able to do for myself, no matter sort of how good the exercises that I was doing were. And it was really helpful. It wasn't quite that I would hobble in on my crutches and then come out singing and dancing, but it was a little bit, you know, I was close to that. I would say it was, I think maybe there's no cheap treatment, but it was, for me, it was worth every penny. It was worth us budgeting differently in order for me to have the treatment that I had, in case that makes a difference to anyone listening.
If anyone wants to get an idea of what not necessarily your treatment or an osteopath treatment, but an idea of what manual therapy or what a hands-on assessment would look like, there's some videos on our Instagram page and on our website of what you might expect from that. And like you said, you don't need to worry that it might be painful or something. It's not causing pain. There might be, you know, like when you get a chunky massage or something, but
it felt like sort of like post-exercise pain, if that makes sense. Like a sort of like my body has worked pain rather than like the stabby pain that I was experiencing from the PGP itself. And even that was sort of like, oh, it's even just different pain. Great. Like it was just a different sensation. But it was good to feel like my body was doing what it could do.
Is there anything else that either of you would say would be a really important message that you want to give for someone who's experiencing this right now? Maybe start with you, Natasha.
I guess I just, that it does end and it does get better. Or certainly that was my experience, because I feel like you can get through almost anything if you have an end date. Again, I think maybe I was just really lucky that it did end pretty much with giving birth. So hold on to that. It will end. And there is help. It doesn't just have to be like a slog the whole time. There are people who are really good and can help you and will help you. So find them. It's worth it.
You mentioned that you'd spoken to your friend who's a midwife and they sent you to the Pelvic Partnership website, is that right? What did you find most useful about that?
Basically all the stuff about doing all the things that you can do yourself, things like how to get into and out of the car effectively and keeping your knees together and that sort of stuff, because I wanted to make sure that I was doing everything that I could do to make my life as easy as possible. And then the stuff that I was going to pay an osteo to do was the stuff that I couldn't do myself. So it was really useful just to have the, like, make sure you're sitting well and thinking about not standing on one hip like we all naturally do, and that sort of stuff, all that kind of stuff that you do, all the things that you can do to make your life more manageable were really helpful. And then obviously the list of people who are good at treating this stuff, to know that I could come and see someone and wouldn't have to explain what it was all over again.
What about you, Emily?
Yeah, similar to Natasha, really. You know, lots of mums unfortunately have to go through this, but you know, lots of them also see an end, and there is an end to it for sure. I think also saying that the recommended practitioner list, that's really great, it's really useful. But also I think the way that practitioners also approach it can be different as well. So just because you're seeing an osteopath doesn't mean that they'd approach it in the same way that I would, or I might approach it differently to another osteopath. And I think the same goes for kind of physios and chiropractors. Just because they're a physio or just because they're a chiropractor doesn't mean that they treat in a certain way. So, you know, if you feel like there isn't actually as much improvement as you wanted, or you wanted something else from your treatment that one practitioner couldn't quite give you, it's also okay to see another practitioner, or to ask for a second opinion, or to have, you know, the internal exam as well as the external exam, or internal treatment as well as external treatment. So I think that's another thing, just because if you see one person, you think, oh God, I'm still in pain. Is this really going to go on up until 40 weeks or even potentially beyond that? It also doesn't have to. There could be somebody else or something else that could help more. Yeah.
Someone's just joined and they've also asked, they have PGP and it's been very intense recently, but they've been told that they can't have physio or osteo due to placenta previa. Is that something you would agree with?
No.
No, because I had that for the first bit and it moved, but yeah, I don't agree from my personal experience.
Yeah, there's adaptations that we can make as well. Yeah, so there's precautions that we'll take, but it doesn't mean no treatment at all.
I'm surprised by that. I would definitely ask again or ask a different person and make sure that that's the case. Thank you very much, Natasha, for sharing your story and your experience.
Yes, thank you.
Good.
I'm really happy to hear that you found things on our website useful as well from the Pelvic Partnership.
So helpful.
To anyone else who's watching, just make sure if you are starting to experience symptoms or starting to experience some pain early on, or if you've had PGP in a previous pregnancy and you're thinking about having another baby or you're pregnant again, make sure to ask for help early on and really push for it. Have a look on that page on our website, the Living with PGP one, and there's advice on there about how to speak to your doctors about PGP or your midwife or anything like that to make it clear how that pain is affecting you and what treatment you would like. Also, stay in touch with us. You can find loads of information on our website and on our Instagram. We are really struggling at the moment, so if you do find our resources helpful and you use them and you recommend us a lot to other people, if you're a midwife or a healthcare practitioner, or you do, exercise classes or anything like that, please mention to people that we are really struggling. We have about 4 months of funding left at the moment, so we're desperate for donations or any type of support that people can give us. So please spread the word.